the continuum of care that we provide for our clients. So on the Solving Hunger Today side, we have those direct services, and those are the items that the programs that we offer that help people in their immediate time of need. That's our agency partner program, our backpack program, our mobile pantry, our new Fresh Market program, and our home delivery senior program. On the other side of the spectrum, Ending Hunger Tomorrow, we work on more self-sufficiency and helping our neighbors make better choices, help them to be able to be a little bit more self-sufficient. And on that side, we have our resource coordination, SNAP outreach, and our education program. I'm going to tag Margie.
Hi, Margie Deveron with the City of Lafayette Economic Development Department, but as a senior planner and project manager. But today I'm here as a member of the Grow Local Urban Gardens Network. This is an organization that began, no pun intended, but quite organically back in 2015, when a number of people who were gardening locally got together, not realizing that there were others out there. Since that time, we've grown to over 20 gardens, and half of those, 12 of those, we call sharing gardens. And those are gardens that no one person owns it, you know. So we have small and large gardens, and they are planted as one by volunteers, maintained by volunteers, and anyone who's walking by, who lives in the neighborhood or is going from one place to another and passes the garden, they can pick anything from it they want. Our signs say, pick what you need and pull a weed. And it's also a community building activity. Our mission, I'm going to read it straight off of our brochure, is to support and encourage urban gardening through action, education, and organization, enhancing community and quality of life. We are a network of gardeners in Lafayette, Indiana, devoted to building, nourishing, nurturing community through urban gardens. And we do this, the sharing gardens are primarily in the near downtown area. We used census data to show, census data and a map that showed that within this area, people would have to walk more than a mile to get to a grocery store. So these folks are going to the gas station and getting food that's full of salt and fat and not healthy at all. So our goal is to feed people, and in the process, make friends and build community. That's
great. Thank you, panelists, for sharing that. As a way to continue just to talk about maybe an overview of your organization work, can each of the panelists share some of the short and long-term goals of your organization, thinking about future plans, programming, and goals that you all have?
Sure. Are we going to just go in the same order? Okay, great. So LTHC Homeless Services, we really do have some immediate goals, and I'm thinking of this both in terms of how we operate and sort of what we're forecasting for our business plan, some short and long-term, some concepts there. So in terms of immediate needs or short-term plans, we really want to make sure that people who are experiencing homelessness, and we are particular to say it that way, we don't work with homeless people, we work with people who are experiencing homelessness. I'm sure as members of the Purdue community, you're well versed in that person first language, but we really want to make sure that they are getting connected to care. So we're located in what we call the Engagement Center. It's in the 1200 block of Union and Salem Streets. And there is a 24/7 access point that people who are coming into homelessness can get connected to care. And those include things like showers and laundry. Of course, we have meals, we have lockers and medication lockers. We are not the primary shelter, the primary overnight shelter in our community for any population, but we do have an overflow opportunity for people that for whatever reason can't get into the primary shelter. Maybe they miss the hours, or they're full, or, there could be some reasons there. So we do have some some crisis housing opportunities. And we do emergency housing with families and veterans as well. But really just at a very basic level, getting people into services. If they don't need us, if they're not homeless, getting them connected with the resources that are more appropriate for them, but to really get them into a place where they can start accessing services, feel connected to people, start feeling better immediately. And then from a longer term plan, like what is our goal for these guests? Obviously it's housing, like we don't do rocket science here. We try to save people's lives, and housing is a part of that. Like we really believe that people can't do better if they don't have housing. And so that's really the goal that we're shooting for all people. We have case managers that work with folks on their individualized housing plan, which is sort of the roadmap to get them connected to their housing solution. We have an employment specialist. We have an entire health and wellness department here, because physical, mental, and behavioral health are for all of our guests, which is a reflection of the entire community. People are really struggling. It's hard to access care. It's hard to sustain whatever changes that you need to make, particularly when you're living street homeless. And so we want to have those resources for people. We have a lot of Purdue organizations, particularly in nursing and pharmacy, that are coming on site as part of that health and wellness, as well as other providers, to get people into the services or get their prescriptions filled, whatever those things might be. The vast majority of clients that we work with will go into housing on their own in the community with a regular landlord. So just like many of you are living in a rental, you have a lease and all of that, that's the vast, for the vast majority, that is the housing solution for people that we work with. They may need some short or moderate term financial and other case management types of assistance, which we can provide through some of our programs. But for some folks, they're just not going to be successful with a regular landlord. And in those cases, we become the landlord. So LTHC actually operates 99 units of what's called permanent supportive housing. 88 of those units are for single or coupled individuals with no children, and then 11 units are for families with children. All of those permanent supportive housing locations have staff on site. And again, we have outside providers that are coming to help connect people. And really, that sort of is the jumping point for what is our agency's long-term, or at least next phase of goals. There is simply not enough affordable housing in Greater Lafayette. We have people that are stuck in homelessness because there is simply not enough housing. There's not enough units. There's not enough landlords. And so because of that, we said, okay, well, then we are going to have to be the landlord to get people out of homelessness. So that will be our next phase of services, is to get those resources here into our community. Thank you.
Thanks, Jennifer. That's great. Tracy?
As for the Hanna Community Center, we want to continue reaching and assisting the youth, seniors, and adults within the community itself through whether it's child care assistance, health presentations, health interventions, referrals, or health screens. Granted, I know, of course, COVID's limited majority of all of us in terms of what we can and cannot do. However, hopefully, in terms of long term, COVID becomes a bad memory, we can increase our reach or find out what else is needed. Because most of those that we serve either are just out doing quarantine, lost their job, or whatever factors are taking in place. So we're trying to have short-term scholarships to help aid in one less thing to worry about, have their kid taken care of. Because with our programs, we do provide light snacks and light meals. And I don't want to assume that that's the only meal that they're going to have today, but we treat it as such. And then through our food share programs with neighboring nonprofits, if we have food, we'll send it home with kids and seniors and hope that, that makes a difference in their lives. in terms of adding to that long term, to continuing what we're doing, have a bigger reach, work with those nonprofits if we're not able to serve them. If they're in need of food, send them to food finders. And they're in need of housing, can LTHC help them? What can we do to make it easier on them, but also to make a difference in the community?
We just wrapped up our strategic plan for 2022 through 2025. So I kind of hit on those, but of course, our long-term goal is ending hunger. We believe that everyone deserves enough access to healthy, nutritious food to live a healthy lifestyle. And that's that we'd like to put ourselves out of business. I think all of us would up here and make that happen. But in the next few years, what we're focusing on is increasing food distribution. And what we're really kind of working on this year, which I think you all will find interesting, is to better assess the needs of our communities to meet those identified needs, especially of the underserved populations. An example of that is, it was very lucky that the old Save-A-Lot space was just up the road from us, but it was in a perfect location that helped us do that. I'll talk about this a little bit more later, but we're also looking at where all of our mobile pantries go. A lot of people don't realize that Food Finders actually serve 16 counties. So we're headquartered here in Lafayette, but we serve the surrounding 16 counties. So we have a very rural population as well. And in the past with our mobile pantry program, for example, it's kind of based on where we can find a parking lot big enough, or maybe who's sponsoring it for us or who we're working with in the community. And this year, my team got together and took census tract data and for each county that we're going to, and we looked at where those underserved populations are. And we took the time to try to find some new partnerships, some new churches, some new schools, places like that in each of those communities that we can try some new spots and better reach some of the folks maybe who haven't been able to get to us in the past. So that's one example. All under increasing food distribution at the fresh market and the access to food. We've added 2 bilingual staff members to better serve in our resource coordination area. We're working on language and signage and things like that, which has been working really well for us. Since we opened the fresh market, we've seen an 8% increase in the Latino population that we've been able to serve. So we're really excited about that. We're going to be starting neighbor focus groups of the neighbors that we serve through the fresh market. How are we, what's working, what's not, what can we better do? How can we help you understand our policies and kind of find some common ground with that? We are working to increase our foods to encourage, which are our healthier foods. Several years ago, we made a commitment to, we have to purchase a lot of produce. We moved 3 million pounds of produce alone last year throughout our service area. So increasing healthy food options and also increasing culturally relevant food as well, looking to better do that. We're working to increase our SNAP benefits. We've built up our resource coordinator team, not only for Lafayette, but for our surrounding counties as well, so that people can have access in hand to the resources they need, and then hopefully supplement the gaps that they're coming up with at Food Finders and our agency partners. We're working to solidify our agency partners. Our agency partners are the soup kitchens, the shelters, the food pantries across our service area who may historically get food from us. So making sure that they're all set and they get everything that they need, they're getting the food that they need to help continue doing the work on the front lines. Another big part of our strategic plan is educating. The title is Educating and Empowering People to Improve Self-Sufficiency and Stabilize Household Food Supply. So that's kind of, again, that more self-sufficient side of the spectrum. So we're expanding our education classes. They've been kind of paused because of in-person classes have been paused because of COVID, where we were set to relaunch them in January. We had to kind of drop that back again. So we're hoping maybe for a relaunch in February, but really working to move our education program to our surrounding counties as well. So we're looking for partnerships with that and expanding our resource coordination program throughout the other counties that we serve also. And then lastly, all of that comes back to making sure that we have the infrastructure in place to meet all of our strategic plans. We're looking to actually purchase the fresh market location. When that came to us last year through a grant, we were able to kind of put it together really quickly in the summer of 2020. The years have all run together. We just celebrated our first year in there at October 1st of 2021. So, we're looking at all those options now. It's been such a success in that location. We had intended for that to be temporary, but it's been so successful, we can't go backwards. It's been a much better experience for the neighbors that we serve, as well as our volunteers. And so now we're looking at the potential of buying that facility and kind of looking at our different facilities there. So, thank you.
say grow local. Our plan, we don't have a strategic plan. Our plan is just to keep growing. We feel like the strength of our organization is in our partnerships. Again, when we started, it was just, a handful, maybe, 5 or 6 folks that got together who were gathering that wanted to share information and experiences. We have now, let's see, on our email distribution list, our meeting notices go out to more than 60 individuals. And those include partnerships that we have with organizations, including Food Finders, Lafayette Urban Ministry, Hanna Community Center, Habitat for Humanity, Friends of Downtown, Purdue Extension, Bauer Community Center, Salvation Army, Imagination Station, Girl Scouts, and recently, just at our last meeting, we're now going into a partnership on a project with Riggs Community Health Center. And those are just organizational members. We have government members, churches, First Baptist, Bethany Presbyterian, Federated Church, Brown Street United Methodist, Trinity United Methodist, Congress Street United Methodist, and then we have neighborhood associations. So, our strength is in our partnerships. Everybody has something different to bring to the table, whether it's resources, talent, equipment. I mean, we share everything. We have a strong connection, Purdue University, through their service learning program, and they're helping us, especially with educational materials. That's something that we feel like we're missing, because the gardens are open 24/7, but we're there maybe 2 or 3 hours a week with volunteers weeding and managing the garden. So when people come by, they don't really know what's going on there unless there is signage that explains it. So we have, because of the neighborhoods that we're in, we want everything to be in both English and Spanish to make it accessible to anyone. And everyone's welcome. I mean, it's not a membership. You don't have to pay. If you are food insecure or not, if you're walking by and there's something to pick, you're welcome to pick it. And then anything that's growing in addition to that we don't see, get picked every week, when we are there managing the garden, volunteers will pick the extra food and we'll take it to Food Finders, or, we're talking about, making stronger partnerships with some of the, food pantries or kitchens where we could take this food, but nothing goes to waste. Our volunteer base is as diverse as the people who use our gardens. We made connections with community corrections, and we have folks that come and work their service hours in our garden. And, the plus to them is that when they're done, they can take some food home with them. So it's a win-win for all of us. We've been successful in crowdfunding campaign that we have every year. It's just for a month, but we usually make between $2,000 and $3,000 just with local donations. Last year, we were really fortunate. We applied for a grant with the Community Foundation and SIA, and they both said yes. So we were able to purchase a trailer and a large walk-behind tiller that we can load up and we take around to all of the gardens. So, our goal, again, is to just keep growing. We feel really fortunate that it's been as successful as it has. And we know anecdotally, especially through Purdue Extension, they will go to conferences and they'll talk about what we're doing here in Lafayette, and people come up, it's like, how do you do it? What's the model? Explain how, it's like, it just happened, the right people with the right skills and talent got together at the right time, and it just took off. Involving more people in the neighborhoods that our gardens are near, that would be another big plus. That community building piece is, one place that we are a little bit weak. So.
Thank you, panelists. That gives me a lot of hope to hear about all of the goals and work that you all are doing in the community. So it's really exciting to hear about strength of partnerships, and I love that goal of working yourself out of a job. That's great. The next question, maybe on the flip side of the goals, I'm interested to hear about some of the challenges you face, both in providing some of these services to the community, but taken another way, maybe the challenges that you see the residents facing in the community. It could be particularly interesting to think maybe about how those challenges have changed in the past few years with COVID and other changes in our world. It doesn't have to be related to that, but that could be of interest as well.
Okay, thanks. I had technical difficulties. Can you still hear me? I'm now on my phone. So, okay.
We can, yeah. Thank you.
Good. So, yeah, certainly COVID has played a significant and frustrating part in how LTHC has operated in the past couple of years. We've moved into this location that we call the Engagement Center in January of 2020. So we were really just kind of hitting our groove here in March when everything started to shut down. And it was particularly unfortunate for us because the whole vibe and design of this building is community, right? Like, these are our people. We really, look out for each other and create that sense of community, and the whole idea that services are under one roof, until we had to say, but get 6 feet away from me. And so that really was a problem. The one silver lining that we think we've experienced throughout COVID is that it has really shown a light nationally on the importance of housing as a healthcare measure. Like when we had the shelter in place orders and you have to socially distance, the population that we serve, and we are a critical service, so we never have shut down. Like we're their house, right? Like we have all of these people in a congregate and enclosed setting. So we had to be very diligent and continue to be very active in trying to do the things that we can to protect not only our staff, but our guests and the community as a whole. But in terms of the bigger non-COVID challenge, I think that we face, I sort of alluded to earlier, which is that just, again, this is nationally not specific to Tippecanoe County, but there is just simply not an adequate supply of affordable housing. There's just not enough places for people to live. So homelessness is always going to be managed or ignored, which is, also an unfortunate truth, until we can really have some sweeping change from a national and legislative standpoint to get people into housing, to make housing available. And unfortunately, Tippecanoe County is the third most expensive community in the state of Indiana for housing. And at first you're like, third, wow, that's really bad. But then you stop to think, like, really, how many communities in the state of Indiana are there? But for communities of our size across the country, we are the 12th most expensive housing community. So we do have a particular issue with that in this community, and it's going to take some significant changes to really impact that. So those are sort of probably the two of the bigger challenges. And of course, the ongoing battle with people understanding homelessness, like they think they understand why people are homeless. And it's very often a person-centered blame, like, well, they just didn't work hard enough, or, that sort of thing. Well, you have to make more than twice minimum wage in Tippecanoe County at 40 hours a week to afford housing. So it's not about working hard enough or how many jobs you work. So just getting people to understand that, I think, is an ongoing challenge as well.
And as for Hanna, of course, COVID's the number one. And ideally, you run into the issues too, where what is it regarding? Are they quarantined? Did they lose their job? Did they lose their income? Did their income change? Granted, we can only do so much in terms of providing scholarships and things like that, but we like to look a little deeper. some parents or some seniors that we serve are more open than others to where we find out a little deep, they lost their job. They're not able to afford food, or they run into the issue to where it's like, I don't know whether I should pay for childcare or if I should pay for food. And it's granted, it's uncomfortable conversations, but conversations that we need to have because the need's just getting bigger. And the resources are only what we have together as a community whole, but we could think outside the box in terms of, okay, let me find more information. Do you qualify for another program, for another nonprofit that we can connect you with? Or transportation is a big one. I've known a lot of parents that have sold their vehicle because they couldn't keep up with insurance and they'd rather have food on the table, but also too, are unable to pick up their kids. So granted, we serve 6 LSC schools. We'll pick them up from school. We'll bring them over to Hanna. If we're aware of that, we can think outside the box. Are you home at this particular time? Maybe the Hanna van can come and drop these kids off. Same thing with seniors. We're having that issue with seniors where they can't get to their doctor's appointments or they can't get to the grocery store. Majority of our time, unless we're using our van sit, what can we do to utilize our vans for those that need it? And worst case scenario, we just have to find a driver, but we have the vehicles, we have the means. How can we think outside the box? So there's current conversations going on with other nonprofits where how could we be a better community partner, but also serve the community and hopefully, lower the need of transportation or lower the need of childcare or, yes, we would all like to, work ourselves out of the jobs because then so we know what we did was right. We know that we served our community. We could go to sleep at night, but ideally the need is still there. And of course, like with the loss of income, granted, we're grateful that we're CCDF and Build, Learn, Grow, our state scholarships. Ideally, we can determine coverage immediately as long as I know how many people live in the household and what the income is. And then provide those resources. How can I get on CCDF? How could I apply for Build, Learn, Grow scholarship, or just our in-house scholarships that we're grateful for our community businesses and partners that support, because the need is there. And of course, you're not going to know those conversations unless you start having them, and little signs to where you see different people picking them up, or they didn't pay their tuition, or there's an inquiry in an email that's telling you otherwise that there's another issue going on. We could all be better community partners, not only if we listen, but take it a step further to where how can I help you and connect you with those resources. Thank you.
For us, I think the number one most obvious thing right now is inflation. That's hitting both food finders and of course the neighbors that we serve really, really hard. The number of clients that we serve, I'm just speaking of the fresh market right now off the top of my head, but our numbers have not gone back down to what they were pre-COVID. In fact, last week, we just continue to see a rise. Last week we had 65 new clients, and a year ago, we probably saw maybe 20 new clients a month coming in for the first time. And for the last several months, it just continues to rise. So that's definitely hitting the folks that we serve, obviously, really hard. A lot of them haven't, even started to recover in any form or fashion from COVID. So there's a lot of challenges going on, obviously, just with the economy. That all kind of goes back to funding. I'm sure we can all say that. I often say that, we can only do as much as our community will support us. And there's always new ideas for programs and things like that, but we have to be obviously very careful about our donor dollars and where we put our funds and looking at where the needs are. It's really, really hard to look at 16 counties and decide where those resources go. But we do have a lot of data and mapping and things like that guide our choices with that. But from that also comes misunderstandings about, I know there's so many food pantries, or people say that a lot. There's so many food pantries in Lafayette. Why do we need one more? Just getting away from that mindset that there's too many, or that they're competitive, or that someone should only shop at one place. Unfortunately, everyone's open different hours, and a lot of folks, because of accessibility and things like that, having a food pantry a couple blocks from their house, even though we're on the bus line, it may not be feasible for them to get across town. And that's still something that we try to kind of, it's a challenge. So, having more food pantries in our community is not a bad thing. Getting more food out, making it more accessible to people. Everybody has different hours of operation or the amount of times that they allow people to come. All those things have to do with access to food. And so those continue to be challenges for us. And I think Jennifer spoke to this as well, but just the compassion for people that are in need of services across the board. I think kind of, again, a silver lining or kind of a light that came from COVID for us, just like with Jennifer and LTHC, across the country, it was able to shine a light on the importance of food banks. Again, everybody saw the lines and the food banks and the cars lining up. And that's been wonderful, for us to have that attention again. But we've been doing this for 39 years. This is what we've done all the time. And we want people to know that we're always here for them. And this is what we do. But that compassion starts to wane after a while. And, we all need it as a community together, not to be questioning why, people are coming again, but are we doing everything that we can to serve them?
Can I throw in here, just sorry, Margie, before you get started, but I think that is a lot of what I think when we have these opportunities to speak to such a large group, the benefit of helping people understand, and your openness to understanding is really the gift that you're giving back to us, because when you know what you have learned, then hopefully that makes you a more powerful ally for any of us or whatever organizations that you're passionate about. So we, I think, as a group are grateful for that. Sorry, Margie.
You gotta say it when you're ready, or you'll lose your train of thought, right? Boy, our challenges and goals. I know we used to go to different information fairs and events, whether that be, like we would go to the cat health fair, or we partnered with Franciscan Health and went to some of their fairs. And it was a great way to get information out, like our maps, but to talk about what we do, because it's a great way to try and recruit volunteers. So, we weren't able to do those during COVID. And I know at the beginning of the first growing season with COVID full blown in 2020, there was, like for a hot minute, we thought about, do we still do this? And it's like, well, of course we do, because people are really going to need us. So we really didn't skip a beat much as far as garden development use, because you could have 10 people in the garden and you were, 15, 20 feet away from each other. So that was never a problem. Without the events, I think, maybe we need to look at more locations to put our maps out. I happened to be at the health department over the lunch hour, and I noticed they had a small stack of our maps. And I, said, hey, we're going to be printing more soon, so we'll bring you a new supply, because it didn't look like they had a whole lot left. So making those connections, probably through our partners, we'll, figure out where those are. And we've talked to about wanting to expand our partnership with Lafayette School Corporation. I forgot to mention them, through Harry Smith, who is, on the call today. He has partnered with 2 different elementary schools, Miller School and Vinton School, because they're both like within a block of one of our gardens. So, I think it's second grade elementary class every year has a field trip. They don't have to load up, in a bus. They just walk out the door, walk down the street and into our garden, and get to have hands-on. Everybody walks away with a little zip bag of, green beans or tomatoes or something to take home and talk to their parents about. So, we look at where our gardens are located, and there are other elementary schools that may be a little farther away than just a block, but they could still come to our gardens. And we are more than happy to have volunteers there, to have some sort of a program. So, there's that education piece, is working, one-on-one with those schools. But, as I had said earlier, when we are physically there so few hours compared to the hours that the garden is actually open and accessible, it's hard to connect with the people that use it, the garden users. So that challenge of what does that education look like, and is a sign, that explains what vegetable this is enough. Having programs, and that was something that we talked about with our meeting this week with a representative from Riggs. Like, they want one of their education specialists to come into the garden with people that are participating in this program, hands-on in the garden, but talk about, what do you do with the food now? And the gardens that we have that are at churches, most every church that's a member has a commercial kitchen in their building, so we could have a program. People could come, we could pick food, we could walk in and, and have a cooking demonstration. So, that's one way to expand what we can provide the users. But, again, that outreach, we're so busy growing plants that we kind of forget about who's in the neighborhood. We need a stronger relationship with neighborhood organizations, if there is one, where our gardens are located, to reach out to them. Could be another good source for volunteers, but to reach out to the residents, because it's surprising how many times, as long as our gardens have been around, the number of times you're working in the garden and someone walks by and you just, hey, how are you doing? You like to garden? Do you know about this garden? And they walk over, they have no idea what it is. It's been there for 5 years, 6 years. And we explain how, yeah, you can pick from it whenever, because there are folks that walk by and assume that it belongs to one person, or one group. And if they go and pick anything from it, they're stealing. We're like, no, take it. It's your, if you're hungry, if you're walking by, it's yours. It's your garden. So, trying to get over that education hump, I think, is one of our greatest challenges.
Thank you all for sharing those things. I'm struck really hearing you all talk back to back of just the interconnected nature of the work that you do, and the challenges as well of transportation to healthy food or culturally appropriate food and housing, and all of the ways that those speak to each other. So it's really interesting to have this conversation all together. At this point in time, I do want to shift to audience questions. There's a couple that are starting in the chat, so I would invite you to add more to the chat. I'll start with one there, and after that one, you can also feel free to unmute yourself and ask questions to our panelists. But the first one I see here that hasn't been answered is a question for Jennifer from Matthew Thomas. It says, question for Jennifer, can you comment on the housing first approach to addressing homelessness, whether this exists near our community or in Indiana anywhere?
Yes, I can. And yes, that is the model that LTHC uses. It is the model put forward by the federal government. So if you're receiving federal funds, that should be the model that you're following. Essentially, what Housing First says is that there's never a point that a person is ready to get into housing. Everybody is ready now. We need to get people into housing as quickly as possible. Because the longer they're in homelessness, the more traumatic that experience is. They're going to make bad choices, bad things are going to happen. And so Tippecanoe County at LTHC, we're what's called the coordinated point of entry, which means we own the master list of people that are experiencing homelessness. We want them all to come with us to get connected. And there's an assessment tool that we use. Every community in the state of Indiana uses the same tool. And it prioritizes people based on their vulnerability score. So it's like golf. You want to have a lower score. That means you have less troubles. So the top of the list is people that have the highest score, which means they have the most barriers to housing. And because we work from a housing first model, those will be the people that we get into housing solutions more quickly, because we know that they're already in danger of some other things happening to and by them because of their risk factor. We have seen this model work very well. The idea again is to get people into housing and then wrap and connect the services to them so that they're able to sustain it. Good question.
Jennifer. What other questions do you all have for our panelists?
I have one. One of the purposes of this forum was to provide a gateway for people to volunteer with your organization. So I was wondering if, number one, if you have an anecdote or a story of interest where someone volunteered and how it impacted them, and number two, if you could you put something in the chat, the correct link for people to use to connect with your organizations?
LTHC is in there already. It's just meals@lthc.net and we'll get you connected. I've been here for 5 years and I've only had one experience where a volunteer did not love their experience volunteering here. She had some very specific concerns that for the most part were out of our control, but otherwise our experience, whether you're an individual, a small group, a large group, you want to do it once, you want to do it ongoing, we can be creative in getting you connected, and people really enjoy it and learn about our population because it's not what you think.
I can speak to that as well. Thanks, Dan. We typically use about 45 to 47,000 volunteer hours a year. So volunteers are really, really important to us. And I think the moment that sticks out to me, I remember it was Friday, March 13th, 2020. And this thing called COVID was coming our way and we didn't know what the heck it was, but we had been noticing that our volunteer numbers were dropping drastically. Purdue groups were falling out, Purdue was canceling. And, just looking ahead at knowing that we were essential, we had to stay open, but we rely so heavily on volunteers. How are we going to make this work? That just, reminded me. So that's kind of the first thing that came to mind when we talked about our relationship with volunteers. They're so important to all the work that we do. So luckily we were able to use the National Guard for a while. And then we've had some amazing, wonderful volunteers that have stuck with us through thick and thin. We have a great relationship with Purdue. We have folks that come over from different classes that have to volunteer. We have a great relationships with, the student groups that come over and volunteer, and that all means a lot to us. In fact, over the last couple of weeks, we did a call out last week that we're really short on volunteers coming up right now. And it's a combination of Purdue wasn't quite back in session, so folks weren't really back in their routine yet and out volunteering, plus obviously the threat of the COVID surge and those sort of things. So it just means a lot to us. I put our link up here. It's really easy to schedule a shift. I always like to say that we have something for everyone. So if you like to kind of be maybe kind of back behind the scenes, we have packing and we have a clean room, we have food that can be sorted and packed. And if you like working with people, then the Fresh Market is a wonderful place to volunteer with us and really get to see the community that we're serving and talk with people and just kind of see that instant spontaneous, reaction there. One thing that I think has been interesting for me that's been kind of driving me crazy for the last year and a half, and it finally dawned on me over Christmas break that I kept waiting for our volunteer program to kind of get back to normal is what I kept telling myself in my head. Like, we just got to get back to normal. And I realized over Christmas that this is our new normal. And what's changed for us is that our locations and our programs and the Fresh Market, like the kind of volunteering that we're doing is changing, and it's changing our relationships with our volunteers. I don't get to see them as much anymore. They're not as interacting with our staff as we're used to and as we like. And because like at the Fresh Market, we ask volunteers to show up about 15 minutes ahead of time, but because we're actively they're running and they're getting right back out there on the floor and serving people, we're kind of missing out on that opportunity to educate people and to talk with them about what we do and why it's important and what you're going to experience today. So we're working with our volunteer team right now to kind of shore up those things that have really changed, or maybe we haven't had the staff or the resources over the last couple of years with COVID, but kind of bringing all that back full circle, just to make sure that our volunteers understand their importance and how the work that they're doing today touches the rest of our mission.
Yeah, I've got a couple volunteer stories, and I see that Harry put our website in the chat. We also have a Facebook page, which we use a lot to announce that we're having a work session in one or more of the gardens and what time and when to show up. But yeah, in 2020, when all the volunteers were falling off for people like Kara, they were showing up in our gardens because they could, you know, it was outside, and you know, so the distancing and numbers of people, you know, didn't become a problem. And I guess my favorite volunteer story, and it's one that I've told many times, so there's probably at least a half a dozen people on this Zoom that have heard it. But I volunteer my time in the Erie Street Garden, and there's a neighbor that lives right next to the garden, and he has helped in the garden. He kind of keeps an eye on the garden, and I would say shamefully, because there are no demographics between myself and him that we share, sex, income, race, education, you name it. And because I'm an older woman, if I was walking down the street and I saw this guy, I would cross the street to the other side, just because that's what I've learned to do. I met him in the garden. We have so much in common. He's become one of my best friends, and we've helped him out at different times when he needed it. So the friendships and the partnerships that we make, it's like, it's all those barriers can be broken down because everybody's got to eat. You know, it's as simple as that. So those are my stories.
Tracy, did you want to add anything? I know you've been in the chat as well, but I want to open it up in case you do want to add anything here.
Yes, I will share one of the stories. I mean, I have many since we have so many different volunteer opportunities, but I had someone come in and wanted to assist with health screens in terms of how do we do blood pressure and BMI, because that we could do in-house. And of course, you know, showing them that we did it on themselves as well. That way they were comfortable with it. Found out that they had like high blood pressure, no signs, no nothing. Ended up going to the doctor and finding out that they had underlying medical conditions, in addition to the blood pressure, that they wouldn't have never known if they didn't come and volunteer. And then, so that's just amazing. You don't know who comes to your door and who you're going to touch and how we're going to assist. And it's just, those things are just amazing.
Thanks, everybody.
Thanks, Tracy. One question came through the chat from Tammy Beaver that says, do any of your agencies have any urgent donation needs right now?
For LTHC, I'll never miss an opportunity to share because we always need help stocking our shelves. Social media channels are our best way for you to know if we have an urgent need. There are items that we frequently need, but we put urgent needs out on social media. And right now it's deodorant, really men and women's travel size deodorant. Our address is 815 North 12th Street, but we accept donations on the 13th Street side of the building. There's a door with a little doorbell, and so donations can come there, but thank you for asking.
I'll go. We also never have a lack of needs. I would say the number one thing right now is continuing funding for the fresh market, because we are seeing such an increase in demand there. Obviously volunteers, we're always in need of volunteers. We have a variety of places for that. But really any program, if someone's able to make a donation to Food Finders, 96 cents of every dollar goes directly back towards food and programming. And if you're making a donation through our website or something like that, you can identify which program if you want to choose where that goes. So we appreciate it.
Any last question from the audience? I have one just to wrap us up as we're approaching 1 o'clock. I'm wondering, ending on a note of hope for the future, I'm wondering if you all could share stories of hope. What gives you hope to continue working in the community, things that motivate you. We've talked a little bit around the issues of environmental justice, but if you have anything that specifically relates to that and fostering environmental justice in our community, what gives you hope and motivation to continue to work in these fields?
That's an easy one for me, and I'm glad I got to go first so I can share this. I work in a place that matters. Every day I'm a part of saving someone's life. I'm a part of getting someone connected to housing. Now, I don't do it directly, but the role that I play is a part of that, just like donors are a part of that, and volunteers are a part of that, and our community partners are all a part of that. And that is an amazing way, I think, to live your life, because we're all in this community together, and everybody has some role to play. On Monday for Martin Luther King Day, we had middle schoolers here volunteering, and those are kids. Everybody can do something, and it's just a real honor for me to be a part of that, and have a piece in what is critical work, because those that are experiencing homelessness are people, and they're people that really need our help.
It's essentially continuing not only up with our short-term and long-term, but increasing our presentations, increasing our health screens, making it available. Granted, we do them on Tuesdays, but anyone that comes in and asks for blood pressure, we're happy to help. Just making sure the community knows of the resources, not only by us, but every nonprofit, to where if they're in need of something, I mean, life happens. Who do I need to connect you with? That way we could assist further. And if you need food, childcare assistance, provide that information, just be knowledgeable of our community partners, so we could better assist. Thank you.
I do have a story that comes to mind recently. We have a man who is currently receiving our home delivery program. So he gets 2 boxes a month that a volunteer takes to him. And this was a couple months ago, but he came in kind of on an off week just to get a gallon of milk, and talked with one of our resource coordinators. We come to find out that he's battling cancer. He's older and has been walking back and forth to get his chemo treatments to where he needs. And just when you start to hear the stories of people, like we kind of, we understand hunger, we understand people are homeless, but then when you also, the other surrounding factors that go into their life and what's going on in their life, you don't even have a way to get to your chemo. You probably can't even pay, can't pay for it as well. So we were able to hook him up with a bus pass. We've kind of bent our own rules and are making sure he has a bus pass from here on out. But then we're also able to kind of reach out to our volunteers who are doing the delivery. And if you get a little extra time and could kind of talk with him, we don't know if he has family around, what all the situation is. But at Christmas, we were trying to push some extra things his way. It's just, I think for him, like, at least one other person in this community knows that he matters and that we can help him with that. And we just, all of us, we hear stories like that day in and day out. And it makes it real for you.
Something that I'm encouraged by, and it in the beginning, I didn't think it had anything to do with Grow Local, but through my job with the City of Lafayette, I'm on the leadership team for the Greater Lafayette Climate Action Plan. And when we talk about sustainability and vulnerable populations and ways that we can, just improve our community, people growing their own food, it doesn't matter who you are, where you live, what your income is. Everybody has to eat. And I think, again, through education, we may see Grow Local becoming a bigger partner and player in that climate action plan effort, because that's everybody, top to bottom.
I just want to come in and say thank you to all of you. For those of you that don't know me, my name is Carmen Moreau. I work in the College of Health and Human Sciences, and I'm the chair of the MLK committee. So I've interacted with several of you before when we had you here on campus in Findler Hall. Appreciate anytime we get the chance to talk to you, share your services, let people know about the volunteer opportunity. So just think it was a really good way to bring our topic of this week of environmental justice, exploring environmental justice, into the community, so it wraps up. So I can't thank everybody enough here today. I also want to thank all of the people that helped put this presentation on this week. So, Becca's helped us out greatly. There were a lot of panelists that Jeff Duke put together for Thursday for climate change. I appreciate else being here with us on Wednesday. On Tuesday, Laura Engel put together our keynote. Today, Diane and Dan put together, all of you got everything together for that, and the volunteer opportunities on Monday, as well as Erin Eastonley that has done so much on the communication standpoint for us, getting everything put up on the website and getting the social media pieces out. We have had at least 125 people at every single presentation this week. So that's amazing, with our most capping out at 200 one time. Several people have reached out to me about wanting these on video, wanting these as a recording. And we're going to work to try to have that out to you by the end of next week is our goal. We just have to make sure that we're going through everything. Erin Eastonley is going to help with that. We just need to make sure that we're doing everything the Purdue way, and that we've got every access for everybody. So we will send that out to our colleges. And we will make sure that anybody that was on our volunteer status today or any of our panels, that we make sure we get that sent out to you as well, so you know where those are located if you want to share those with other people too. So,
and Carmen, I want to take this time to say thank you for your leadership on this committee. This is our partnership, the College of Agriculture and the College of Health and Human Sciences. This is one event that we partnered together. And Carmen, you've been just fantastic taking it over by yourself. And so I wanted to give you accolades in front of whoever is left on the call. Thank you to all the panelists. The entire committee did a fantastic job of pulling this week together. So thank you so very much to all of you.
Thank you, Dr. Morris. I think that wraps up everything. So happy Friday, everybody. Stay warm, stay safe, and we hope to see y'all soon.
Thank you all. Thank you, panelists.